Some victims of abuse and neglect are easy to identify. Others are not. They may not have obvious injuries, and they may not be willing or able to speak for themselves. One of your roles is to identify victims of abuse and get them the help they need. From this video, you'll be able to describe 3 forms of abuse and neglect that are often misdiagnosed, signs of physical assault, and steps to take if you suspect violent abuse. Neglect, emotional abuse, and Munchausen syndrome by proxy are easy to miss unless you know what to look for.
Hi, my name's Yvonne. I'm the nurse. Hi, Les. How are you doing today?
Victims of neglect may be children, disabled persons, or the elderly.
I'm alarmed because if he falls, I would have difficulty picking him up.
Their caretaker may not have the skills or ability to perform their role. Sometimes neglect is intentional. Mismanaging prescriptions and delaying medical care is neglect.
And this is empty. Has he been out of this medication?
Other signs include malnourishment and dehydration, inappropriate dress, and poor physical hygiene. Emotional abuse is also frequently misdiagnosed. It is often the underlying cause of other ailments. Signs may include withdrawal, submissive behavior, and depression. Victims often have nonspecific complaints, such as headaches, neck aches, backaches, fatigue, and insomnia. These might justify additional investigation. Munchausen syndrome by proxy, MSP, is a rare but life-threatening form of abuse. Here, the parent induces or fabricates symptoms in a child. Induced symptoms may include apnea, diarrhea, vomiting, CNS depression, and bleeding. The parent's motive is often to ingratiate themselves with healthcare providers. These children will usually have a long history of symptoms that defy explanation. Symptoms may diminish when the parent is not present. If MSP is not diagnosed, the child may undergo painful and dangerous procedures. Diagnosing MSP requires specialized investigation. Your hospital has protocols for handling these cases. Violent physical abuse may be difficult to confirm because the victims often can't or won't report the abuse.
Okay, hon. We're going to work through this together, okay?
Okay.
Everything's going to be okay.
Victims may conspire to hide the abuse out of embarrassment or fear.
I'll go along.
Because victims may not report the abuse, you need to be aware of 3 indicators of assault. Unusual injuries, an implausible story, and the behavior of the victim and the abuser. The first indicator is unusual injuries. Some injuries have obvious causes, such as these ligature marks. Others are not. It's unusual for adult women or elders to have injuries to the face, neck, breast, or abdomen. Look for multiple injuries that appear to be unrelated or are in different stages of healing. On children, check hidden areas of the body, the bottoms of the feet, and between the fingers and toes. Abusers may injure these areas to avoid detection. This was caused by a coat hanger. Look behind the ears. This child's ears were boxed. Blows to the ears are painful and can cause permanent hearing loss. Look for unusual patterns or shapes to the injury. These were caused by a belt. Loop-like patterns are often caused by a flexible object, such as a whip, belt, or rope. The police believed this was caused by an extension cord. Burns can also have characteristic shapes. Police investigators can often match them to a specific object. In this case, the burn perfectly matched a curling iron. This was not accidental. This burn also has a distinctive shape. Straight lines forming a partial V. Investigators found that it perfectly matched this stovetop burner. Healthcare providers didn't know what might have caused this burn. Police later found that it matched this spoon. It was heated to use as a weapon. These are cigarette burns, a common form of abuse. Symmetrical or bilateral injuries, injuries to both sides of the body, are indicative of abuse. Any genital or rectal trauma in prepubescent children should be investigated. This child was struck repeatedly in the genital area with this shoe. The abrasions on this infant's genitals resulted from sexual abuse by a male in the household. Implausible stories are indicative of abuse. This child presented with suspicious bilateral burns on the feet. The parent's story was that he walked onto a hot floor grate. However, a grate would leave distinctive lines, not smooth burns. Investigators found that a parent had pressed the child's feet down on this frying pan. The third indicator of assault is the behavior of the victim and abuser. Professor Barry Morenz is Director of Forensic Psychiatry at the University of Arizona Health Sciences Center.
There are three phases to this battering cycle. The first being an escalation phase where tension builds between the abuser and the abused. And then the battering phase where the abuser actually does the abuse, does the damage. And then this honeymoon phase, or this apology phase, where the abuser is regretting what they've done. They're hovering, but they're also acting in a very loving, supportive way, touching the person, rubbing their back, hugging them. So they may seem superficially very loving, but something's happened, something's not right.
Mr. Stewart, it's our hospital policy that the assessment be done in private. I'm going to have to ask you to wait in the waiting room, please.
You know, I think she would rather if I stayed with her. She would feel better.
Abusers may also be reluctant to leave the patient alone with healthcare providers.
Instead of a person who's angry and upset and hostile that they've been abused, they may be remarkably passive, quiet, and almost seemingly dependent on the person that's hovering around them.
If you suspect violent abuse, it's important to carefully follow your hospital's protocols. In general, there are 4 steps to take. Interview the patient. Plan for safety. Document. And report. Interview the suspected victim about possible abuse.
Mrs. Stewart, I've seen these injuries before, and generally speaking, they're not accidental. Can you tell me a little bit more about what happened?
You don't really know the whole story, what's going on. So the best approach is in a very non-judgmental, very straightforward manner, ask the individual, have they been hit? Have they been struck? Have they been hurt in some way by a loved one? Provide empathy, provide support, provide understanding, and listen.
Mrs. Stewart, there's people that can help you. If you don't feel comfortable at this time, we can give you information so that you can seek help when you do feel comfortable.
The interviewer must have the victim's trust.
Because if he does,
Never
then
blame
maybe
the
God's worse
victim.
for me, and I don't have to deal with that when I get home.
Interviewing children requires special
Do you
training.
feel comfortable telling me that?
Certainly if you have children that may be in this very volatile atmosphere, who may be abused themselves, it may be very important to interview those children, but unless you're trained and skillful at doing those interviews, you probably should not do it.
doctor's assessing your wife.
Plan for the safety of the patient and the medical team.
Well, she's been in there long enough, and I want to see my wife. I want to see her now.
I understand.
If
your
there is
feelings.
any possibility of violence, notify security or the police immediately. Avoid any confrontation with the suspected abuser.
In there with her. Right.
Do not put yourself at risk.
I understand you're tired of waiting. The doctor's assessing your wife right now, Mr. Stewart.
Let the police or security
Can I
handle it.
interrupt you? She just
They're telling
explained.
me I
She just
can't see my
explained to you
wife.
what's going on, sir. And if you want a further explanation, I can do that outside. Thank you.
Document your findings. Take greater than normal care as the record could become legal evidence. Be objective. Subjective entries and opinions dilutes your credibility and the records. Finally, every state has laws requiring reporting of certain types of abuse and neglect. All states require the reporting of child abuse. Be sure you understand your obligations.
Hi, this is the urgent care center. We need
Abused
your
people
help.
show up
Attention.
in doctors' offices, emergency rooms, urgent care centers, and they're the type of people that may present with injuries, and it's not quite clear what those injuries are from. The best thing the healthcare worker can do is consider abuse in the differential. Make sure to ask about it.